Trainee doctors at the nation's major hospitals announced to tender their resignations to protest the expansion of medical school admissions quotas. Patients' concerns have grown, and the government today renewed its stern message. Shin Se-byuk has this report.
The government on Friday sent a stern message to doctors who are planning to go ahead with the collective submission of letters of resignation to protest the government's recent decision to increase the number of medical students.
We will issue individual directives to resume work for the residents who have declined to see patients. Should these directives be ignored, we will proceed with appropriate legal measures.
The Yoon Suk Yeol administration announced last week a plan to increase the overall medical student quota by 2,000 to over 5,000 by 2025 to address chronic doctor shortage in rural areas and specific medical fields. The government has also ordered 221 training hospitals nationwide to ban any mass leave-taking and to retain essential medical personnel, warning of the possibility of the latter's licenses being revoked if they do not comply with the ministry's immediate return-to-work order in the event of a strike. The government's solid response came as trainee doctors at 5 major hospitals in Seoul decided to collectively submit letters of resignation. According to the Korean Intern Resident Association, all residents at 5 major hospitals in Seoul will submit their resignations by the 19th and will stop working after 6 a.m. on the 20th. The so-called Big Five hospitals are Seoul National University, the Catholic University of Korea Seoul St. Mary's, and Severance Hospitals and Samsung and Asan Medical Centers. Some of the hospitals have confirmed that all of their residents have already agreed to hand in resignation letters. As of Thursday, according to the Health Ministry, a total of 154 letters have been submitted at 7 hospitals, although none have been accepted. If the collective action goes ahead as planned, it would mark the 4th time doctors have taken such action since the first medical strike in 2000. Meanwhile, medical students nationwide have decided to submit leave of absence requests en masse for February 20th, next Tuesday. This decision followed an emergency meeting held on Thursday evening by representatives from 35 of the nation's 40 medical schools. During the meeting, all participants unanimously agreed to coordinate the submission of the request while ensuring unified action across all 40 medical schools. Another meeting to further discuss plans for upcoming action, including the possibility of boycotting classes, is scheduled for later on Friday. However, according to the Education Ministry, as of Thursday afternoon, no leave of absence requests had been submitted to the schools. Shin Se-byuk, Arirang News.